short legs, long legs, as a structure in your skeleton. We're going to talk about that right now, and how it imbalances your pelvis, which can then throw off your lower back, and then you can have compensatory activity in the rest of your spine, which can throw your entire spine off, maybe not as much as I'm showing you right now, but you can see that if your leg length is off, short leg or long leg, if your leg length is off, it can throw off the balance of the pelvis and throwing off the alignment of your entire spine. Follow? So looking for this issue, looking for a long leg or a short leg, in the medical literature they call it LLI, leg length inequality. It's also called LLLI, lower limb length inequality. Let's go LLI, leg length inequality. Or I go by the short leg. That's the words that I use in my office with my patients and doctors and staff, the short leg. Because the short leg you're going to correct with a lift. That makes sense? So we're going to lift the short leg if necessary, if appropriate, if clinically appropriate. Now, we can take the long leg and belt sand off the foot. That would be a permanent correction. It's a little uncomfortable, and it's not covered by insurance. I'm not sure why, but it's not covered. So we don't do that. What we do is we boost up the short leg, okay? Now that's easy to do with little heel lifts, and I have little heel lifts in my office, these little $5 pieces of rubber, and they're at different lengths. They're at different millimeters of length depending on someone's presentation, okay? So what do we look for? Well, if I think it's important for somebody to have x-rays, let's say lower back x-rays, let's say they have low back pain, and maybe in their examination when we're doing orthopedic checks and so forth, and I'm looking at posture, maybe we visually see a long leg or a short leg. Maybe when I put them on the table, either face down or face up, and we do a visual leg length look, we see one leg is longer or shorter than the other. So then we're like, let's take an x-ray of this. So when I order x-rays, I order standing x-rays. Standing x-rays are critical, and I have it right on my script in big bold letters so the technicians will actually do it. And where I am here in Woburn, Massachusetts, the x-ray techs that I refer out to, they're very used to these scripts now, and they just do them standing. They just do them standing, which is great. So we get to see what the spine does, not only from the side, but from front to back under gravity, and that's very important. So then we start looking at leg length inequality, and if the x-ray is taken right, we have a larger x-ray taken of the lower back and pelvis. So we see the lumbar spine, the lower back, then we see the pelvis, and then we see the top of the leg bones, or the femurs, if you will, and we see the tops of the femurs, and then we can measure that. We can literally measure that in millimeters. So imagine I'm in the x-ray facility and I'm standing, my shoes are off, so the shoes aren't throwing that off. I'm in my bare feet and I'm standing there, and then I have this x-ray taken. So it can confirm our suspicions. And if we see a leg length inequality on the x-ray, we can measure that in millimeters. And if needed and if appropriate, we can start adding or shimming the short leg side, right? So it would be like taking this, here's someone's pelvis, right? It's dropped on one side. It's dropped on one side because there's a short leg. And we start shimming up the foot, which in essence starts to level out the pelvis. When you level out the pelvis, the lower back curvature might end up straightening out like this. And that will take some stress off the discs and joints in the lumbar spine. And the discs and joints are mostly the pain-sensitive tissues in the lower back. Myself, I have a 6 millimeter short right leg. I've known that for a long time. You see it visually, you can see it on leg checks on the table, and then it's been confirmed on x-ray. And here's the next step, is when I added a heel lift, I went back in the x-ray room. We don't have to do this any longer, but I went back into the x-ray room, shot an x-ray, and my lumbar curvature, which goes this way, was improved. I'm like, that makes sense. Plus, I put it to trial, and I feel more balanced when I'm walking. I feel better when I'm running. I feel like I'm more balanced. Makes sense, okay? So I responded clinically appropriately to a heel lift. This is something that I've looked at for decades in my office. I have one testimonial on my website of a woman who came to see me, and she's still a patient with mine now. She came in over 20 years ago, and she had chronic low back pain for years, and she came in to see me, and she had already been to some different practitioners and doctors and so on and so forth. And I look at her, and you could visually see easy that the pelvis is way up on one side and way low on the other side. I'm like, my goodness, let's get an x-ray of this. She is 20 millimeters, almost an inch at 25 millimeters, 20 millimeters off on one side, started putting the heel lifts in, almost instantly a good chunk of her low back pain went away. Now, we had to build her up to 20 millimeters. We're not going to do that inside the shoes, so she builds up the outside of her shoe by taking shoes to a local cobbler who puts on an extra sole. We already have it measured out, and we have it figured out, which balances perfectly, and her back is doing wonderful now. So that's an extreme example of somebody at 20 millimeters, but not everybody's that different off. I'm 6 millimeters, a fairly common thing. Other people can be shorter than that or longer than that. We have to experiment. More on that in a moment. So I want to let you know that this has been around for a long time. The study of leg length inequality. Here's a research article brought to my attention by my colleague, Dr. Dan Murphy. Thank you very much, Dr. Murphy. A study of lower extremity length inequality in the American Journal of X-ray and Radium Therapy back in 1946. 1946, they started looking at that, and they started taking standing X-rays on soldiers. Okay, so this was already being studied in World War II because this is just post-World War II when this information was tabulated. So this was done back in World War II time. It became immediately apparent that making of X-rays of the lumbosacral spine in the recumbent position, as frequently done, completely prevents the discovery of such pathologies as this, meaning you can't take the X-rays lying down, you have to take them when they're standing. And in this study, it was 1,000 soldiers, good size study, equal leg lengths in 1,000 soldiers, 23% were level, were equal. Okay, so 1 of 4 were equal. That means 3 of 4 had leg length inequality. Short leg, 77%. 1 to 5 millimeters off was 40%. 6 to 10 millimeters off, 22%. 11 to 21 millimeters were getting 3/4 of an inch now at 13%. And more than 22 millimeters was 1.7%. So 2 out of 100 of the soldiers were almost an inch off. And that's what I have found. I can think of 3 patients of mine that were almost an inch off in the past 10 years. And once we lifted it, I can think of 2 of them right now, 2 young men, kind of like me, huge guys, huge, massive guys, power lifters, that was a joke, power lifters, and 2 of them were just almost an inch off, and they were getting pain, no surprise, under their heavy deadlifts and squats and so forth. We started lifting them there. We actually played around with some pads in the gym, and it really helped their lower back pain a lot. Okay, then in Spine magazine 20 years ago in 2000, they talked about lower limb length inequality, or LLI, short leg, and they said it was a large part of the development of idiopathic scoliosis. Remember earlier that I talked about, again, if you're young and you're a twig and you're growing up to be a tree, as the twig is bent, so grows the tree, right? One of the reasons I'm a chiropractor, because my parents were told this to bring in their kids, all right? Why wait, okay? So if your leg length are off and that sets off the curvatures in here, that can be not but a cause of scoliosis, okay? So in adults, we correct for this, but if we see this in children and we see their legs are off, we will lift them, sometimes temporarily, sometimes permanent, depending on what's going on. Because remember, as they're growing, those leg bones might come back into balance. So that has to be watched over time. Here's a study out of the Archives of Physical Medicine and Rehabilitation, November of 2005, so 15 years ago. This is a conclusion. The name of the article was Conservative Correction of Short Leg and 10 millimeters or less of relief of chronic low back pain. So they took a bunch of people with chronic low back pain and said, if you have a short leg, we're gonna boost it. But they also had a control group where they didn't do it. Conclusion, shoe inserts appeared to reduce chronic low back pain and functional disability in patients with a short leg of 10 millimeters or less. So they're talking 1/3 of an inch or less, not that much, made a big difference in chronic low back pain. So these are the things that we look at in my office as we're evaluating people's spines and postures and structures, top to bottom, inside and out. And remember, even people with chronic neck pain could have a contribution down below. As I like to say with people, if the foundation is off, the roof can be off, and vice versa. So it's a good idea to look at the entire spine and make sure that you're keeping in mind the possibility of having a short or long leg. I'm Dr. Scott Fuller.